My name is Dr. Richard Evanson. I'm a hip and knee specialist here at Plain Orthopedics. I originally grew up in Denver, Colorado. Later went on to college at Brigham Young University, where I met my wife. We have 5 beautiful children, which we continue to raise here in Dallas, Texas. After I met my wife in college, went on, did medical school in Missouri. And then I did my 5-year residency in orthopedics through the military at Eisenhower Army Medical Center in Fort Gordon in Augusta, Georgia. After I finished my orthopedic residency, I did 4 years as a staff orthopedic surgeon at Fort Benning in Columbus, Georgia. During that time, I had 2 years where I had the opportunity to do a mentorship at the Houston Clinic, where I was able to focus my training a little bit more on hip surgery as well as joint replacements of the knee and hip. Once I completed my 4 years at Fort Benning, I decided to go back and do an additional year of training and did a fellowship at Duke University in hip surgery. A lot of my reasoning for treating hip and knee pain kind of stems from initial injuries. I ran track and cross country in college, and during that time had experiences where I was taken out of being able to train and compete due to certain injuries. I had mentors and surgeons that I had met with and worked with who helped me get back into competition and being able to complete my 4 years as a Division I collegiate athlete, which I'm very grateful for. And having seen that experience and the ability for them to help these athletes to return back to what they love so much, it drove my passion for wanting to be able to do the same thing for them. In addition to the injuries I experienced as a college athlete, I also had a powerful experience while I was on a mission trip in Ghana, Africa, where we traveled with a group of orthopedic surgeons and plastic surgeons to help treat these patients. And that was a mind-blowing experience to me, how much of an effect we could have on these patients, helping them get back to their daily routines and their activities. During my 4-year experience at Fort Benning as a chief orthopedic surgeon, I became the self-designated hip surgeon because I had a natural passion and a lot of experience in hip surgery from my previous training. Really enjoyed treating the hip, not only because it was challenging, but also because I could see a significant improvement in these patients as they dealt with hip pain. And it was especially during my time when I deployed to Kuwait for 6 months, where I was able to hone in on some of those skills and enjoy treating a lot of these soldiers that were not only in the Army, but also covering at that time the Navy base, the Marine base. A lot of times they would experience injuries, and there were simple things that I could do with conservative treatment and surgery that helped them get back to their normal duties and their job. Now that I'm here at Plain Orthopedics, I'm able to take some of those lessons that I learned, some of those skills that I developed in the military, and apply them to those patients that I see here. One of the things I want my patients to know and understand is that although I'm a surgeon, I'm passionate about being able to perform surgery, is that I like to exhaust all of our non-surgical treatments options first. There's lots of different ways that we can do that, from injections to physical therapy to perhaps minimally invasive surgery or even biologic injections, things that can potentially get them back to their activities without resorting to surgery. My goal with every patient is to listen to their concerns, listen to their desires, and see what I can do to get them back to their activities. And in my eyes, it doesn't matter if they're a professional athlete, a high school athlete, or say an older patient with arthritis that just has goals of living day to day without pain. I'm going to treat them with respect and with dignity and do my best to listen to their concerns.